Okay, so today we're going to talk about the contents of the pelvic cavity, plus a little bit about the male and female reproductive system. Okay, so the first organ which is found in the pelvic cavity is the sigmoid colon. It's a continuation of the descending colon. So the sigmoid colon is covered by what? By peritoneum, and it is attached to the posterior abdominal wall by these mesentery called the sigmoidal mesocolon. Okay, so the sigmoid colon is very what? Movable. It flexes, it can move around and play. Okay, so the sigmoid colon it starts at the level of the what? The pelvic brim and ends at the level of the third sacral vertebra. Done. So some of the relations of the sigmoid colon. So the sigmoid colon has anterior relations and what? Posterior relations. So in males and in females it's what? It's different. So in males, the posterior relations of the sigmoid colon, we have the rectum. It's because the sigmoid colon can is flexible, it's movable, it's very movable. So it can end up in this pouch called the rectovesical pouch. Okay, so the posterior relation of the sigmoid colon with the rectum and with the what? The sacrum. Then the anterior relation, we have the what? We have the blood. Done. Then in females, like males, the posterior relations are the same, but the anterior relations, the sigmoid colon's anterior relation, we have the what? The uterus. Done. Then another thing to note about the sigmoid colon is its what? Blood supply. Blood supply comes from the what? The inferior mesenteric artery via the sigmoidal arteries. So the artery of the foregut is the celiac trunk. The artery of the midgut is the what? Superior mesenteric artery. Then the artery of the hindgut, this one is the hindgut, okay, is the inferior mesenteric artery. So the sigmoid colon gets its arterial supply from the what? Sigmoidal arteries. Done. Then the venous drainage, it will correspond with the what? With the arteries. So venous drainage is via the inferior mesenteric veins. Done. Then the lymphatic drainage, it will be it will follow also the vessels to the inferior mesenteric nodes. Done. Then there's a very important clinical which is called volvulus. Due to the mobility of the sigmoid colon, okay, it can sometimes wrap around its arteries, okay, and it will like damage the artery, and this will lead like to like impaired blood flow to the what? Sigmoid colon. The condition is called what? Volvulus, where the sigmoid colon kind of wraps around itself and it kind of like does this. Let me show you. It kind of cuts its blood supply here. It cuts its own blood supply due to the twistingness it does when it's what? It's rotating. Okay, done. Right. So we move. Okay. Then from sigmoid colon at the level of S3, okay, we have another organ which you call the what? The rectum. So the rectum starts at the level of the third sacral vertebra and ends at the level of the what? The tip of the what? The coccyx. Unlike the sigmoid colon, which is wrapped around in peritoneum, the sigmoid colon, its upper 2/3 are the ones which are wrapped around with what? With peritoneum, while its lower 1/3 is devoid of what? Peritoneum. Done. Then the rectum, it has anterior and posterior relations. So the posterior relations of the rectum, we have the what? The sacrum. Then the anterior relations of the sacrum, the anterior relations of the rectum, they differ according to gender. So you see that in the female, okay, anteriorly we have the what? Like some parts of the sigmoid colon. Then we have the uterus. Then we have the upper portions of the what? The vagina. Upper portions of the what? The vagina. Okay, done. Then in males, we see that posteriorly we have the sacrum. Okay, then anteriorly we have like some coils of the sigmoid colon. Then we also have the blood, the posterior surface of the what? The blood. Not only do we have the posterior surface of the blood, we have the ductal system of the male reproductive system, such as the seminal vesicles and the ejaculatory ducts. They also form anterior relations of the what? The rectum. Done. So the shape of the rectum, it kind of follows the shape of the what? The sacrum. It curves with the curving sacrum. Then it also is like pulled. Okay, it also is like, you can see it as a curvature at this side, and it also is like a curvature at this side. Okay, let me show you another diagram. It has two curvatures. Okay, it will have like a curvature like this one, this curvature. It will also have, it has a posterior curvature and an anterior curvature. The anterior curvature now is due to the if you remember, we talked about the puborectalis. The puborectalis forms part of the levator ana group of muscles. They kind of pull the rectum. They pull and they form a sling around the what? The junction between the rectum and the anal canal. So this also contributes to like the flexure which we see anteriorly. The flexure which you see posterior is due to the curving of the rectum following the shape of the what? The sacrum. We also have these mucosal invaginations, which you call transverse folds. Okay, they are due to the invaginations of the inner circular muscle and the inner lining of what? Mucosa. Okay, so we have three of these folds. We have a superior one, a mid one, and an inferior one. Okay, so these folds, they're important in the sense that they kind of temporarily store the fecal matter, so that the fecal matter does not continuously move from the rectum to the what? To the anal canal. It moves in stages from the rectum to the anal canal. Okay, done. Then another thing to note is the fact that during let's say, for example, we want to examine the sigmoid colon. The best way of examining the sigmoid colon is via the what? The anal canal. So we put our rods in the anal canal. It's called sigmoidoscopy. We put our rods via the anal canal, but we should take note not to poke these folds. Okay, due to also the curvingness, the inward curving, the outward curving, or the curvature of the what? The rectum. We should take note not to poke these flexures as we are trying to access the what? The sigmoid colon with our cameras. Done. Okay, so we should take note that before the rectum, okay, and like changes to become the anal canal, it forms this dilatable part which you call the ampulla. So when it forms the ampulla, it then pierces the pelvic floor, which you call the pelvic diaphragm. Then it will now be continuous with the anal canal. Okay, done. Another viewpoint, these inward foldings called the transverse folds of the rectum. We have two on the left and one on the what? Right. They kind of temporarily store the fecal matter. as it is passing into the anal column, anal canal. Okay. Then now let's go to the blood supply of the rectum. Okay, so the blood supply of the rectum is simple. We have arteries from the inferior, in fact, the inferior mesenteric artery, okay, its terminal end, the continuation of the inferior mesenteric artery, which you call the superior rectal artery, it supplies the what? The rectum. Done. Not only does it supply the rectum, it also supplies the upper half of the anal canal. Done. The rectum also receives blood supply from the internal iliac artery. It receives blood supply from the internal iliac artery via one, the middle rectal artery. Okay, done. Then it also receives blood supply via the internal pudendal artery, which is a branch of the internal iliac artery. So the internal pudendal artery will give the inferior rectal artery, okay, which will supply like the lower aspects of the what? The rectum. Done. Then the veins will correspond with the what? With the arteries. Done. Then the lymphatic drainage of the rectum, the lymphatic drainage, it will go to the pararectal lymph nodes. Then after going to the pararectal lymph nodes, right, some of the lymph will go and follow the inferior mesenteric vessels as the superior rectal artery is going and becoming the inferior mesenteric artery. So some vessels will follow and go to the inferior mesenteric nodes. Done. Then some will follow the internal iliac artery to the what? To the internal iliac nodes. Done. Then the nerve supply, I did not talk about the nerve supply of the sigmoid colon and the what? The rectum. So most of the pelvic organs, okay, which are found in the pelvic cavity, they get their nerve supply from the what? From the inferior hypogastric plexus. So the sigmoid colon gets its nerve supply from the inferior hypogastric plexus, and also the rectum gets its nerve supply from the inferior hypogastric plexus. Okay, done. Then some of the relations of the rectum, I think I mentioned them. No, I mentioned that of the, yeah, I mentioned them. Okay, so yeah, that was the sigmoid colon and the what? And the rectum. Okay, another important thing to note before we close is this clinical, okay, which you call the portal systemic anastomosis. We talked about it last time in the sense that we have communication between the superior rectal veins and the middle rectal and inferior rectal veins. So the middle rectal vein and the inferior rectal vein go to the systemic system, while the superior rectal veins, they go to the portal system. So this forms an important anastomosis, which called the portal systemic anastomosis. Okay. So if there is like damage to the liver, right, we see that the blood will now take another route and will go via these the systemic system, and it will cause like distension of the what? Of it will cause distension of the arteries which are found here. Okay, they start to like become swelled due to the fact that blood is now going what? Via this route. It's going via this route. Okay, to go to the systemic system. So the systemic system is formed from the inferior vena cava. Done. Okay. Okay, so that was the sigmoid colon and the rectum.